Hi, my name's Rachel Liston. I'm the food policy dietitian at University Hospitals Bristol and Weston. I'm just going to take the opportunity to share with you a few slides to give you a good introduction to what it's like to work within nutrition and dietetics at UHBW. So I'm going to talk a little bit about who we are and what specialities we've got working in the team. I'll show you where we are and then share with you why we love working in Bristol and why we think you might love working in Bristol also, and talk a bit about career progression opportunities within nutrition and dietetics at UHBW. So I'm going to share with you a bit about who we are. So our services at University Hospital in Bristol and Weston can be described from three different teams. So we have adult nutrition dietetics at Bristol Royal Infirmary, where we've got a service to Bristol Royal Infirmary, Heart Institute, Haematology and Oncology Centre, and St Michael's Hospital, which is our maternity and gynae hospital. All of these hospitals are located almost next door to each other, so really really close, and you can see the specialist areas that dietitians based in the acute team in Bristol will provide a service to. The acute team in Bristol is divided into a Team A and Team B. We're fairly large, there's over 40 members of staff, and it's growing all of the time. Over in Weston-super-Mare at Weston General Hospital, this is a much smaller district general hospital, but a centre of excellence for older people's care and elective surgery. We have 14 dietitians based over in Weston. Our home management services, commonly known as HMS, working locally, is our home enteral feeding service that provides a service for both adults and paediatrics in the community in Bristol and the surrounding areas, and there are 17 dietitians working in HMS. So sharing some pictures of our team here, you'll see we wear a peacock blue uniform at UHBW. That's both in Bristol and in Weston, and I've got pictures here of some of the various things that we've been involved in recently. You can see top right pictures of us launching new menus in food policy and the promotion work that goes alongside that, trying to tie nutrition into all kinds of celebratory and campaign events on the wards, and the Jubilee was an excellent example of that. We're always looking for the opportunity to promote our service and participate in things like Dietitians Week and sharing some of our resources with the public. We've worked on QI posters, and you can see a few pictures of some of those being presented there. And we'll contribute to education with our peers within UHBW. So you can see pictures of our nutrition and hydration study day just there. We're a large team and really value the opportunity to come together. We're quite a friendly team in both, Weston, HMS and in Bristol. And there's just a few pictures here of some of the shared lunches and celebratory events that we've had recently. So looking at where we are, if you are looking at a job that's advertised in Bristol, bit about our Bristol sites, I've got a picture at the top left of the screen here of the Bristol Royal Infirmary from the main road. Our acute team within nutrition and dietetics in Bristol is based within the Bristol Royal Infirmary. This team provides services to the BRI, Bristol Royal Infirmary, Bristol Haematology and Oncology Centre, which is a hospital located next door in an adjoining building, the Bristol Heart Institute, and St Michael's Hospital, which is a 5-minute walk up the hill behind the Bristol Royal Infirmary. All of these hospitals are found pretty much in Bristol city centre, which is excellent for transport links in. We're very close to the bus station. The Bristol Temple Meads is about a 15-20 minute walk away. Bristol has a network of electric scooters, which people often use to get to work. We've got a really big cycle centre with changing facilities, so we're really sort of pushing that ability to be able to make it easy for you to cycle to work, and really handy for access to wherever you live in the city. In Weston, so Weston is situated out on the coast. You can just see on the map there, it's a short trip down the motorway from Bristol. Beautiful setting, very close to the beach, actually, the hospital itself. Some very much smaller district general hospital, and there's a acute team based there at the hospital. You can see a beautiful picture of the coast at Weston. It's both beautiful sandy beaches, a lovely place to live. So I wanted to share some of the feedback from our staff about why we love working in Bristol. And I've got some of those just shared on the screens here. Our team has grown in both Weston and Bristol and HMS recently, and it's really rewarding to see the teams grow and flourish and bring more expertise in. We have rotations within our team, so Band 5 rotations are set at a year, and we have 4 Band 5 roles in Bristol currently, 2 in Weston, and people really feel that helps with the rotational element, helps them to grow. We have a system, there's a comment here around being able to flex the start and ending hours of your day. So if you want to start work at 8, that's fine, and you'll finish at 4. If you want to start work at 9, that's also fine, you can finish at 5. And we find that some staff are able to just naturally flex their working hours to suit their workload and their work-life balance. And that's saying that the Trust has a great focus on wellbeing. We have wellbeing leads within the team that share all of the wellbeing events that are going on trust-wide and locally within the team, which really helps us to gel as a team and feel that support, if you like. The next few slides just provide an extra bit of information about some of our specialist roles, which I hope that you'll find interesting. This first slide is from Simon, our inherited metabolic disorders dietitian, who's based in Bristol at the Bristol Royal Infirmary. So the number of adults with IMD is ever increasing, mostly due to the creation and expansion of newborn screening, alongside improved treatments and the success of the paediatric metabolic service in Bristol. Demand has grown, and the funding was granted for this specialist adult role in 2020. Simon had to apply for this job, but he has not been disappointed. At first, he felt like the job was going to be too big a task to manage, but the responsibility of caring for complex patients felt daunting. Simon felt that the nurturing ethos of the department allowed his confidence to grow, and he developed a pathway with a fantastic group of people, including 2 excellent dietetic support workers, Steph and Mary, and he's found it incredibly rewarding to be a part of. There's something to be said for having a challenge every day and something new to learn about, and Simon has a wealth of conditions to learn about. It's been fascinating his sharing his learning in departmental CPD sessions. Our next account is from Sam, one of our Band 7 dietitians working in gastroenterology. So Sam provides dietetic input to the intestinal failure service, which is a multidisciplinary team. They provide complex and innovative nutrition support for patients with short bowel syndrome. And they've recently been commissioned to provide this service for the whole of the South West region, which is a really exciting and interesting development for our Trust. One thing that's quite unique about our nutrition and dietetics service is that we have a food policy team that provides service to patients in Bristol and in Weston, and it's led by myself as Band 7 dietitian. We also have a dietitian in Weston, food policy dietitian, and 2 dietetic support workers. So our team provides an element of catering support, so menu liaison and development and nutrition analysis. We also lead on the development of nutrition-related policies and procedures for the Trust. So, for example, the nutrition and hydration policy for the Trust and our Mealtimes Matters Protecting Mealtimes policy. Our team also gets involved with a lot of nutrition educations to support nursing and facilities staff, and are well connected with the heads of nursing to inform on trust compliance with things such as the CQC Regulation 14 and Digest standards. Our Band 5 dietitians are invited to support local nutrition and hydration groups. That means that there's really that link in with nursing education and dietetics, and to ensure that things like nutritional screening are really addressed and promoted across the Trust. So at the beginning, I promised I'd share some of the exciting new developments that have been happening within nutrition and dietetics here at UHBW. These include a new stroke split post with North Bristol Trust. So for those who know, North Bristol Trust is based in the north of Bristol at Southmead Hospital. Completely different trust, but our stroke services are now moved to North Bristol, and we have an exciting dietetic post which has a foot in both trusts, if you like, working across Southmead and in the BRI of Bristol. We've recently expanded dietetics at the front door, so in Bristol and in Weston, so that's dietitians working in frailty in the ED department. We have a number of dietitians that are undertaking supplementary prescribing course to extend their roles. We have seen development across the whole team. For example, we've got a new apprenticeship dietitian role recently introduced, and we've expanded the number of Band 4 roles and the support of our dietetic support workers. And we have a very active internal CPD programme. So that sums up a little bit about us, where we are and what we do. I hope you found that useful and interesting. If you want to learn more about working with us, please do look on NHS Jobs. You can find some more promotional resources around working in our departments on the link for Allied Health Professionals Day featured here. And if you want to look a little bit more about what it's like to live in Bristol or live in Weston, and then I'd recommend you following the links on the screen here and learning a little bit about some of the local amenities. Thank you.